Hi, everybody. Welcome to the afternoon attendees joining us for this session. This is part of a workshop on climate and health funded generously by the Borough's Welcome Fund and organized by Roz Reed, the outgoing director of the Council for the Advancement of Science Writing, and by me, Amber Dance. I'm the program director for CASW. Welcome also to those of us joining us watching this later on YouTube. So our next session is a panel discussion on occupational health and regulations, or in some cases, lack of regulations to protect workers in hot conditions. I would like to introduce our moderator, Nico Rivero. We will give pretty short intros here in the session, but you can look up our speaker's many accomplishments online or on Whova. So I'll just say Nico is a reporter at the Washington Post covering national climate change regulations. He previously worked at the Miami Herald, where he covered attempts to create worker protections in Miami-Dade County, and he's also a former sheriff. Nico, take it away.
All right. Hello, everybody. So I'm joined with a really awesome panel here, and I'll introduce them very briefly before we jump in. So Ashley Ward is the director of the Heat Policy Innovation Hub at Duke. Her work focuses on the impact of extreme heat on human health and community resilience. Claremont Ripley, co-director of the Workers' Rights Project of the North Carolina Justice Center. He's also an attorney representing low-wage workers and who also advocates for changes to state and federal policy to help those workers. And we have Neza Shutakutli, who is a senior grassroots advocacy coordinator at the National Sustainable Agriculture Coalition and also formerly a coordinator at the Farmworker Association of Florida. Okay, Ashley, maybe we can jump in with you. And I want to ask about, there are a couple of cases of workers here in North Carolina who died in the heat, and maybe this can help orient us, and since we're here in Raleigh, you can talk about that a little bit.
Thank you for having me. It's a pleasure to be here talking with all of you, and many of you have probably read in the news or even in the description of this panel, I think, some of the cases that have happened in North Carolina. Certainly the Mendoza case is one that is currently under further investigation, which I think Claire's probably in a better position to describe more about what that is. But I think when we think about occupational exposure to heat, one of the things I like to sort of level set about is when we think about health, we're not just talking about health outcomes, right? We're talking about well-being and all of the factors that contribute, and particularly to the ability for people who are exposed to heat to be able to mitigate the impact of that heat. And so with certain occupational groups, what you have is a circumstance unlike or I'm comparing them, say, to like the U.S. military or student athletes who have pretty stringent rules and regulations about heat exposure. Unlike those circumstances, a lot of times what we're talking about in occupational heat exposure are people who also live in houses that are perhaps aged or not energy efficient. Sometimes there is no cooling standard in the U.S., so that means there's no standard for cooling for public housing, affordable housing, or farm worker housing. And so they don't necessarily have access to air conditioning. If they do, it is not uncommon that they can't afford to run the air condition. Energy burden is a very real thing. When I've worked in communities throughout North Carolina, I commonly hear people talk about rationing their energy use to pay for medicine and food. We had a group of farm workers that we were working with in the coastal plain of North Carolina. It was very common to hear them talk about coming home from work and it being cooler to sit outside their home than go inside their home after it heats up all day. And so there are those issues, in addition to any kind of underlying health issues that are usually part of a variety of socioeconomic and social conditions, not the least of which is a lack of access to health care. So to manage chronic conditions that would then put them more susceptible to heat exposure at work. And so I think it's really important when we think about occupational exposure, particularly when we're thinking about different groups of people and how different regulations affect those groups of people. We're not all at the same playing field, right? We're not starting at the same starting line. And so you compare that to, say, people who are in the military who, have housing and who have good diets and are in peak physical condition. The same with student athletes. All of these other things are highly regulated or managed, right? That is not necessarily the case for many of our workers, and so you have a group of people who are highly susceptible to heat-related illness, working in environments in which they are highly exposed, and going home to environments that offer no mechanism to mitigate that exposure, and it happens over and over and over again. So it's not an accident that we see emergency department visits peak on Wednesdays. And it's because they go to work on Monday, they're exposed, they start to feel bad, they go home, their body can't recover. I mean, everything needs recovery overnight, right? I mean, we do, the plants do, the animals do, our energy grid does, everything. And now we have nights where it is 80 degrees overnight. So that's just kind of setting the stage in a very broad way.
Yeah, and those are the kind of conditions that contributed to the deaths of José Arturo González Mendoza, who died in September of last year here in North Carolina, and also Juan José Ceballos, who died in July of this year on a 101-degree day. So this is an issue here in North Carolina, all across the country as well, and we know that heat deaths are also undercounted. I also want to talk about how those conditions that workers have at home are then compounded when they go into work. So, Nez, I know you've done a lot of work directly with workers, outdoor workers, farm workers, now in the meatpacking industry. So maybe you can talk about how some of the conditions that workers face on the job also can contribute to heat illness.
Yeah, thanks, Nico, and thank you, everybody. It's great to be here and meeting a lot of people who want to cover some of these issues. I think the first thing that always comes to mind is the piece rate system that just disincentivizes workers from, speaking specifically in agriculture, disincentivizes them from actually wanting to take breaks, because for them it doesn't just mean a loss in income, it also means that they're competing with the person next to them.
Hey, can you explain the piece rate system?
Sure, yeah. The piece rate system is what's been the standard for agriculture for a long time. It means that workers get paid based on productivity, what they actually pick during the harvest season. They do have an hourly rate during harvest season for their work, but that is primarily their form of payment, getting paid using the piece rate system. So having to compete against one another for payment just disincentivizes them from actually taking breaks, whether it's for to take water, to just cool down a little bit, or to use the restroom. And also, if the restroom is far away, then that's also just a disincentive to actually take a restroom break, because it means a long time for them to get to the bathroom. Also, water quality. Employers are supposed to provide water for them, but they don't always trust the water. They don't think that it's sanitary, and they often would prefer to bring water from home, but they don't always bring enough. And usually by the end of the day, they are dehydrated. So in one of the studies that we, when I was with the Farmworkers Association of Florida, that we collaborated with Emory University, we found that about half of the workers were already dehydrated before they went to work. They were, 3/4 of them were dehydrated by the time they left work. And also to Ashley's point, most of them lived in crowded conditions, and they didn't have that ability to recover overnight. And also many of them in South Florida, they only had like a window unit. They didn't have AC, and that was just uncommon to have a family that had central AC.
And so I know over the past several years now, workers have been trying to organize to get a national heat standard, a federal level rule that would regulate heat conditions for workers in response to some of these conditions. So maybe you can just give us a brief introduction to some of the protections that people are aiming for there.
Thanks. Well, off the top of my head, because I can find my notes right now. So there are 3 tiers for a heat trigger. One is 80, 90, and 120 degrees. It would provide water and shade breaks with pay and escalating protections coming with each of those 3 tiers. Would require employers to have an emergency response plan with a list of appropriate phone numbers and how to contact them. Also, a way for them to be able to clear directions on how for EMS to get there. It also includes for the highest trigger a rapid cooling body temperature plan, and it also requires record keeping to make sure that every one of these actions are being documented and that outdoor temperatures are being monitored. So that's like a broad overview.
And Claremont, maybe you can help us understand how that compares to the legal standards today. What rules do exist? What obligation do employers have to their employees when it comes to heat?
Thanks. I'm happy to be here with y'all today too. Thank you for covering this issue. So what Neza was just summarizing is what's included in a federal proposed heat rule. So federal OSHA has proposed that. Federal OSHA doesn't have jurisdiction in North Carolina. North Carolina has its own OSHA. So what that means is if that federal OSHA heat standard ever gets passed, North Carolina then either has to adopt to that or adopt its own that is stronger. It's not allowed to just not do it. It has to be as effective as federal OSHA. But it also means that North Carolina right now, while we're waiting on the national one to pass, could be doing its own thing. And there's a coalition of us who've been working on that for several years now, and for a while was feeling very optimistic. We'd been meeting with our State Department of Labor, trying to basically build support with them for adopting as a state heat standard that would protect really outdoor and indoor workers. Y'all have heard a lot about farm workers, but it's also transportation workers, warehousing workers, and other types of outdoor workers who are really at risk. There was a U.S. Postal Service worker who died this summer. I don't know if y'all heard about that. But yeah, so we were meeting with the Department of Labor trying to build support for a rule, and then actually the Department of Labor said to us, hey, we agree. This actually is a really good idea. We need a heat standard, and we're gonna move it forward ourselves. Spoiler alert, they ended up not doing that, and they still haven't given us a clear explanation why. I think it was political influence. I think they hadn't really realized how much opposition they would face from the Chamber of Commerce and the agricultural lobby, who were not interested in being regulated. So the rule ended up not moving forward, but it was really all within the hands of our Commissioner of Labor, who actually just stepped down 2 days ago. Commissioner of Labor Dobson for the state just left, but he was supportive. He was interested in moving this forward until the political pressure was too much. And we just elected a new Commissioner of Labor who has said on the record he's not interested in putting any new regulations forward. So in North Carolina, we were kind of pursuing these two fronts, trying to support the federal rule because eventually that would mean North Carolina has to do something, and also trying to pursue a North Carolina rule so that workers are protected. And really, the urgency has been building. Ashley shared about farm worker deaths we know of this year and last year. We think there are more than that. And that's just the deaths. You know, people get sick as well all the time. So that's where things stand. There's no clear enforceable rule requiring shade, requiring water breaks, requiring work schedules to be adjusted when things get really hot. Our Department of Labor has, if you look at their website, they have this kind of guidance on heat though. So they're kind of counting on employees and employers to just take it into their own hands to protect themselves, which is fine. But it's not enough because especially like farm workers who we're talking about and other low-wage workers really don't have that much power to impact their working conditions. One thing Neza didn't mention when he was talking about working conditions was immigration status and how that plays in too. I would say most of the farm workers are either here on a temporary work visa called an H-2A visa, where if they lose their job, they've also lost their permission to be in the United States legally, or they're already here undocumented, which means, you know, once you get a job, you want to keep that job because it's going to be hard to find a new one. So that just makes it even harder to stick up for yourself at work and say, hey, I need a break, if your boss is not supportive of that break. I feel like I'm rambling past where the question was, but just to close that loop on the guidance from NCDOL, they're saying, I wrote down a couple of them morning, they're saying things that workers should do to protect themselves is schedule heavy work during the parts of the day when it's not so hot. Most low-wage workers don't have ability to really schedule their own work, right? Take more breaks when you're doing heavy work, especially in high heat and humidity. As Neza already highlighted, especially if you're working on a piece rate system, or if you don't have a lot of, you don't feel safe at work exercising your rights, you're not going to be like, hey, I need that break now. And there's also this other issue, which is that sometimes the protective gear, the protective equipment you have to wear makes things even hotter. And NCDOL just says, be aware of that. So all that to say, that is the current environment, and given the election this week, we don't expect all of a sudden for the administration to become interested in supporting new regulations to protect workers. So that's where it stands.
At a state or federal level.
Yeah, at either level.
Yeah. So we don't have an industry panelist here, but I've reported on this subject for a while, and so I'll just raise two things that I think people from industry will say in response to the attempts to create heat standards. One is these rules already exist. We already have OSHA level protections for heat, or sometimes they'll talk about OSHA's general duty clause, which is a basic rule that says you can't put your workers' lives at risk, and you can explain that better. And the second point, which sometimes feels a little contradictory, the first is we already do this. We're already obligated to do this. Second point is sometimes if you make us do this, you're going to drive us out of business, and our business can't survive this. It's too expensive to implement these rules. So I'll open this up to all three of you. We don't have to keep kind of going in turns, right? But those are the two most common points that I've heard, and so I'd love to hear what y'all make of that.
I can take the second point. I'm going to let others take the first point. One of the things that we've been doing at the Heat Policy Innovation Hub is actually calculating the loss to industry from the decrease in productivity and labor loss from heat. This is a really important thing to do when you're talking to industry. Estimates right now in the U.S. from my colleagues at Duke are $100 billion a year in labor loss just from heat in the U.S., $100 billion a year. We're the fourth biggest loser behind India, China, and Pakistan in the world for labor loss for heat. So there is a really sound economic argument to be made. In fact, North Carolina is number 3 of all the states in the country for for loss from heat. Texas is number 1. We actually right now are calculating this is the loss at this rate without a change in worker schedule, and this is what you save when you institute a change in worker schedule. There are a lot of researchers that are doing this kind of work, and it's critical work that's to do so that industry understands that it's not, I wish I could say to everybody that risk to health and life and loss of life is the number one thing that motivates change. Unfortunately, that has not been my experience, right? And so we have to make a range of arguments that appeal to a range of people and decision makers. And so that's certainly one of them. That work is being done, and I think that potentially could move the needle on some of these.
I do have a response to the first point about the general duty clause. I think it cuts both ways. So the idea is basically at the state level and at the federal level, the OSHA statute says that employers have to provide a safe and healthy workplace. So if there's no other rule or law directly on point, like there's no law directly saying when it's over 90 degrees, you have to give a shade break every 2 hours. But an OSHA department who wants to be more kind of expansive about how they interpret that can say, by not giving your employees a break when it got that high, you didn't provide a safe and healthy workplace, so you violated the general duty clause. So that's what Nico was getting at, where some employers will say, we already have to under the general duty clause. And in fact, in the case of Mr. Mendoza, the state OSHA found that his employer, Barnes Farming, had failed him, had violated the general duty clause by not giving breaks, by not providing adequate water. Where do I have that? Only allowed 1 5-minute break in 6 hours, not an adequate supply of drinking water, didn't allow an acclimatization period. The man who died and several of his coworkers had just arrived the week before to work here on visas, and no good training on reporting emergencies and first aid. So there's no rule that specifically says you have to do all those things, but they looked at it and said, by failing to do all those things, you still did not provide a safe and healthy workplace, so they issued them a big fine. It is wrapped up in litigation now. The employer, instead of agreeing with that industry position, which is we already have to do it, they're saying, we didn't have to do that. You shouldn't be fining us. So it cuts both ways, but it's because it's not a clear rule, it's hard to demand that it be recognized as a worker. It's hard to enforce it. And it also means it's very much in the hands of whoever's in charge of the Department of Labor to decide how they want to interpret it. And as I just forecasted, at both the state and federal level, it's not looking good for workers in terms of the man who North Carolina just elected actually has been an OSHA lawyer representing employers for his career. So he's very skilled at saying, no, they don't have to do this. No, that's not a violation.
I just wanted to add that actually OSHA didn't even come into effect until the 1970s under the Occupational Safety and Hazard Act. So it actually takes workers wanting to organize around these issues for them, for any kind of change to happen. But farm workers are one of those excluded groups from the Fair Labor Standards Act, so they cannot, under federal law, organize to form any kind of worker group. There are exceptions at the state level. California does allow them, and so does New York State, and I believe also Washington State, but it's just a handful of states that allow workers to, farm workers specifically, to organize and advocate for themselves in any of these issues. And the other point I wanted to make is that also OSHA is just severely understaffed, and it would take them decades to visit any one of the work sites that they're supposed to be visiting in any given state.
Do you all remember off the top of your heads the number of OSHA inspectors? I think the number is like 1,800 or something for the country, which there's many more work sites than that. So, and also reporting, as we've touched on before, is tough, especially when you have a lot of immigrant workers who aren't interested in rocking the boat and don't want to pick up the phone and dime out their employers. I'll bring up one other point that I've heard from industry as a way of saying this, because I've reported on this issue and I've written about specific worker deaths, and then had industry lawyers and lobbyists call me up on the phone on background and say, oh, well, you know that guy, he was drinking. And they'll send me like the autopsy report that shows alcohol in the guy's blood system as a way of implying that heat didn't do this, working conditions didn't do this, people do it to themselves. So I also want to raise that with you all, because we've touched on this a little bit. Ashley, you were talking about this at the beginning, but these are people who are not working in perfect conditions. It's not like they're Olympic athletes who are training for this moment and have a nutritionist, telling them exactly what to eat and everything, right? They're living normal lives, and then they're going into work the next day and putting their body through kind of extreme situations. So I also want to put that to you all. I mean, how does that play into it?
Well, I think, what I was saying earlier about, this is coupled with so many other social issues, and not the least of which is adequate access to health care. In rural communities, and I really appreciate you bringing up manufacturing, because throughout the Southeast, for example, a lot of people misinterpret occupational exposure to be farm workers. We have a lot of manufacturing workers in rural areas in the Southeast, because, and it's growing throughout the country, because these big warehouses for all this shipping, they're not sticking them in prime real estate in urban areas, right? They're going outside of these places, and the workers there are, in fact, also exposed. And so those are the same areas in which we're seeing historic levels of health clinic closures. And we also see disproportionate levels of underlying chronic illnesses like diabetes and different cardiovascular disease, in addition to things like mental health and prescription medications. For those of you who don't know, there are a whole swath of them that make it even harder for your body to process heat or thermoregulate. And so, very common medications for hypertension, anxiety, depression, these medications can actually make it worse. And so the question is, it's not so much, are you going to have workers that never have any underlying condition that raises their susceptibility? That's the wrong way to look at this. It is whether or not we need to develop a set of responses we can have one set of responses for those who are more susceptible and another set for those who are not. I think the idea that we're going to create one metric for risk for, everybody in this room we would all have different levels of susceptibility. I think that thinking in and of itself is very flawed. And that actually, I think, hurts us when we're trying to think about how to institute policy. The inclination is to say we want to do this one thing because it's easy to implement and easy to write and easy to pass, and it's not complicated to get other legislators to understand it, right? But actually, you end up with policy that is less effective and sometimes more harmful than you intend.
And I know you had thoughts also on access to food and healthcare as another contributing factor here.
Yeah, sure. As Ashley was saying, there are a lot of things that build into those underlying conditions, whether it's access to food and quality nutrition, also just regular access to healthcare. But I think that there are also other occupational hazards that can compound on top of heat exposure, like pesticide exposure, hypertension that also develops from prolonged exposure to heat, and kidney damage from working in the fields for long periods of dehydration, pesticide drift, respiratory conditions. All those things actually build in their bodies over time, and so that it's already an underlying condition that came from their occupational exposures. And there was one more thing I wanted to mention. On athletes, athletes are protected. They're a protected group, and I think that if we can protect a group for their gift, then why can't we also protect this other group of people who are also putting food on our tables?
One point I also wanted to bring up is that it's not totally trivial to implement these things in every situation. Like if you think about people are going to be picking whatever the crop is on acres and acres and acres and acres of land where there is no tree cover providing shade, you have to actually do something to create that shade. Similarly, if you're a contractor working on a construction site, it's not always going to be possible to get you into an air-conditioned space or whatever really easily. So maybe y'all can kind of give us a picture of what these solutions look like when they're implemented. What does it actually take in practice to protect people?
I'll go first. The law does already require for farm workers that are out there doing harvesting that there be a bathroom and hand washing facilities within a quarter mile of where they're working. So if any of you have ever driven around in rural eastern North Carolina or other states, you might see a group of farm workers out in the field. There's a bus that's used to transport them with a little trailer with porta potties on the back. Like they've got this setup that they drive around with them. It has a hand washing setup. It should have a water setup with cups for everyone as well. I don't see why it would be that much harder to like retrofit that bus with an awning that rolls out on either the right or the left or the back, depending on where the sun is. Or to have some pop-up tents that you take with you so that when people are taking their water break, they can go stand under that tent. I mean, it still might be a little hot under that tent, but it's a lot better than it's going to be out in the field. So that, I mean, there are ways to create shade. I haven't seen, maybe this is something y'all are looking at in terms of the cost of what it would be to implement that. But, I mean, they already have to have this whole setup they're taking with them, and they have, I just, you know, putting a little awning on the side of a bus seems like it would not be more expensive than someone's life.
I think we can take a lesson from the military here, okay? Because the military has done really excellent job at this question, right? Because they actually don't have access to air conditioning when they're out in training, right? So they do something called arm immersion. I don't know how many of you are familiar with arm immersion. It is standard practice and protocol. I know at least in the U.S. Army, but my guess is in other branches of the military. We know that immersing your feet in cool water over your ankles drops your core body temperature and can actually save your life. This is a great low drag, low inexpensive way if you're, you know, especially if you're taking care of somebody who's older or disabled and they don't necessarily have adequate access to air conditioning in their home. It's the same concept, except in the military, they immerse their arms over their elbows. So there's every hour, there's a rotation or whatever the timestamp is where soldiers in training immerse their arm. They've even worked out how many minutes you immerse for how many degrees it lowers your core body temperature. So this requires a cooler with cool water in it. Like, that's not really expensive. And there's also an alternative way if you don't want to do that. There's you take your shirt off, dunk your shirt, put your shirt back on. If you dunk your shirt every hour, it has the same effect and reduces your core body temperature. That also is just a cooler of cold water. There are many interventions that have been developed and tested, and science proves how effective they are, that do not rely on air conditioning, that are easily deployed in a variety of settings. And I think a lot of that requires education. I think most of the time people assume it's difficult to do without knowing, and so there does need to be through maybe agricultural extension, because farmers trust what their ag extension officer tells them. They may be in rural areas through faith-based organizations where they can teach people how to implement these things, and people can start, who manage work groups, right, can start thinking about these things. There are many options, and it's not as if we wonder if they're effective or think that they're effective. We have it down. The science has it. Scientists have done their job here, truly. They know how many minutes you have to do X at what temperature to have this outcome. This is not a guess anymore.
One point that I also wanted to make sure that we hit on before we go to questions and answers in a few minutes is the impact of other climate-related disasters. So it's not just heat that workers are dealing with, it's also things, obviously, North Carolina just got hit by Hurricane Helene, and so I guess I'll just turn it over to you in an open-ended way and say, go for it.
Thanks. Yeah, I did say ahead of time, please let me mention other climate disasters. Basically, workers don't have a clear right to refuse to work when it's unsafe or when there is an evacuation order, for example. In Helene, y'all might have heard about the Impacts Plastics factory in eastern Tennessee where 5 workers died. They were caught in a flash flood at work. The reporting I read said that the workers thought it could have been avoided if they had been allowed to leave work. So that's just a very sad example of what happens when workers just don't have a clear right to protect themselves at the workplace. A North Carolina example I wanted to share was from 2018, and it was the Hurricane Florence hit eastern North Carolina pretty badly, and there's this terrible story where a group of migrant workers who live in isolated housing on the farm, and it's usually land that the farmer does not want to use for farming. So it's like the really flood-prone worst part of the farm. That's where the housing is. And these workers woke up to flooding. They called for help. The emergency management said, yes, we're coming. They sent a swift water rescue team. But before they could get there, the farmer called the emergency management and said, they're fine. You don't need to come. And because the farmer was the landowner, seemed like a reliable source, they called off the rescue. So from like 8 a.m. till 5 p.m. that day, the workers are calling over and over again, trying to figure out why they're not getting help. There's all these pictures in the news story that I looked at of just them wading through water outside their camp. And I think that highlights many issues, but the one I really wanted to talk about was like they weren't given a chance to evacuate. They weren't told, hey, there's a mandatory evacuation order for this county because there's a hurricane coming. They're isolated, they don't speak English, they're not embedded in the community, so they had a notion that there was a hurricane coming, but they weren't hearing about this stuff. They didn't know where they could evacuate to, and I really put that all on, and especially when you're bringing in like temporary visa workers to work for you, that is on the employer to have a plan to know how to respond to that kind of emergency, and to not just prioritize your crops by saying, workers, you got to stick around to help me save my crops, but prioritize the lives of the workers too. And we can't count on them just to do it themselves. I think we need a rule making it really clear that that kind of thing is needed.
Thanks. I just wanted to, to your point, Claremont, we actually did hear about a group of H-2A workers in Florida during Hurricane Ian who were, they were made stay to save the crops, but then after we had the hurricane pass through, the employer, who was a contractor, didn't know what to do with them. So he just kind of took them to a town, random town, and just released them and left them to fend for themselves. So I think we can't highlight enough the need for a plan that is required for employers, especially H-2A workers who come and may not necessarily have the language or know which resources to are accessible out there for them.
And on the
Transportation.
Yeah.
And on the language point, there are workers who don't speak English as a first language. There's also workers who don't speak Spanish as a first language, right? They speak indigenous languages, and then they immigrate to the United States, and then they're speaking in Spanish as a second language as a way to try to communicate with their coworkers, already struggling, and then even harder to communicate with authorities in English. Okay, I want to ask each of you for your thoughts on where heat protections for workers go from here. Now that we have the results of this election that just happened, as we just heard, that here in North Carolina at the state level, at the federal level around the United States, the administrations have already signaled that they're not that interested in implementing some of these rules. So what comes next?
I mean, we don't stop. We keep fighting for these. We can't just let workers keep dying, right? I think our approach in North Carolina, there's this coalition called the Farmworker Advocacy Network that I'm part of. So through that and through this North Carolina Heat Stress Coalition, we've been doing this work. And the approach in both has been, we have to educate the public about how deadly heat can be and how it's getting worse and the lack of protections, and educate workers about how to protect yourselves. Even though I'm up here saying, like, we need the rules, it's the employer's responsibility, in the meantime, let's educate workers. I just learned something new about this immersion and am excited to see how we can try to implement that more. And then to keep pushing for the rules, to keep building support for those. The rulemaking process at the federal and the state level is incredibly time consuming, and federal OSHA has already gone through so many of the steps to get to the stage that they're at right now, which is publishing a proposed rule. There was still a long trajectory ahead of it, and I don't think all that work will necessarily be lost if the new administration says we don't want to move forward. Hopefully it can still be like there to launch from when the administration does become supportive. But I think it could also be done through legislation. So if there becomes a popular groundswell for, like, we really need these common sense solutions to save lives, just like we're doing in the military, just like we're doing in sports, then maybe it could happen through legislation.
I think one thing seems a reasonable assumption is that we're going to see a retraction from the federal government toward any kind of investment and regulation on these kinds of topics back down to the states. And so I think to Claire's point certainly earlier about the need to advocate and work in your own states, where you may have a little bit more leeway in your legislature to take a legislative, if not a regulatory approach through an agency at the state level, maybe through the state legislatures. But I truly, truly believe, I really feel like we let industry off the hook here, guys. I really think we do. I mean, we're talking about policy. We're not talking about industry policy. We're talking about public policy. And industry has to be at the table on almost all of these conversations. First of all, they own most of the infrastructure, and they're huge donors to politicians. So, we have to get industry to the table to start having these really difficult conversations. Where's the insurance sector? Like, the insurance sector has a role to play here, and not necessarily on the worker side. Insurance, parametric insurance, we've tested it out in India and other places on the worker side, but we're also testing it out on what it looks like on the employer side. So we don't have employers in who say, it's too expensive for me to do XYZ, right? We provide a mechanism through which they can recover those losses when they occur. And the insurance industry is really poised and interested right now in trying to figure out how they can play a role here, right? So we have philanthropy. And so what do we do? What is the role of philanthropy in helping invest in some of these tools and interventions that perhaps can happen that can help with worker protections also, right? So I think what's about to happen is we're about to get really creative. We're about to get really localized. And we're about to open and widen the table to expect stakeholders that we have kind of excused from the table. And I think we just need to expect that they pull up a seat and sit down with us. And that's what we're going to have to do, because I don't think we're going to be able to look to the federal government to solve this for us. That's what I'm learning, right? They're not coming to save us. We have to do it.
I don't know where I stand exactly on this. I think we just have to keep going, as Claremont say. We do have that OSHA comment period open until December 30th, so I would just encourage anybody who is in a position to, and encourage others to submit comments to do so. I don't think that they will be lost, but I think if enough people submit comments and they keep engaging with all different levels of government, just even the federal government, I think representatives and senators will actually listen if they see that there is grassroots support for something like this. And it doesn't matter what the administration position is. I think if they see that there is actually support at the local level, that they will actually listen to their base, because ultimately they want to get reelected. So just engage in whatever public policy space you can find. And well, you're journalists. I forget that I'm talking to journalists, but yeah, that would be my next steps.
Yeah, and to wrap things up on a somewhat hopeful note, I'll just flag there's one worker-led program that I've reported on that I think is an interesting model. I don't know if it's a perfect one, but where groups of agricultural workers have pressured fast food chains like Taco Bell, Burger King, McDonald's, and also grocery chains to basically sign on to an agreement to preferentially buy their produce from farms that protect their workers. And they have a heat standard built into the rules. And so those are monitored by this worker group, and the standards that they've set are kind of comparable to a lot of the state level or national level standards that have been proposed. So that's also an interesting model that doesn't require government action. That's entirely like an industry-based thing.
That's a great example of how the private sector, we have to expect more from them.
Yeah. Okay, I think we can open it up to questions.
Hi, I'm Fenella Saunders with American Scientist magazine. Nice to meet you all. I'm curious, you were mentioning about worker pressure for outlets, but is there any kind of like fair trade stamp on food so that consumers know if they're buying things that are produced by farms that protect workers?
Do you want to answer that?
I'll just quickly say for this one that I mentioned, there is a sticker, a Fair Food Program sticker, and it's a person carrying a bucket of tomatoes like that. Although I don't know that it always actually appears, because I did look for it in the grocery stores, and I think it depends on the grocery chain. But anyway.
I was just going to add that there is also another organization, the Agricultural Justice Project. They also certified that farms are carrying out fair labor practices, and they do have a sticker. I can't remember what it looks like, but they do exist.
Hi, I'm Joanna Downer. I am freelance for science writing, but I also work at Duke University. The borough's Welcome Fund, located in RTP, just down the road, has announced last month, or September, a Climate and Health Excellence Centers funding opportunity that will award up to $10 million to different institutions. I wonder what each of you thinks the big research questions are in this space. What do we still need to know? Clearly, we have a lot that we could already create policy on, but what else do we need to know?
I think that the answer to that question depends a little bit on where you sit, right? There are definitely going to be issues, research questions that legal scholars might ask, right? Which are probably going to be different than the questions perhaps that, someone from my perch is going to ask. And then that's going to be different than what someone from engineering or the health sector or one of the other sectors is going to ask. So, this is a wonderful opportunity, right, to think about integrating a lot of those perspectives into one center, which would be really phenomenal, because we have, certainly the absolute need to better understand health outcomes. But we also have, and it's not just health outcomes, it's training of medical staff, right, to be able to identify heat-related illness. And then, there's the need to engage policymakers, the private sector, and, diverse multi-sector kind of approaches where you're thinking about the impact to economies and communities in another distinct way, communities being much different than the individual health impacts that we see. And then, you also then have those that do direct outreach and engagement. And so I think it's a great opportunity that they're investing in this. The idea, and for me, would be something that's less siloed and that gets us to the table with people that we don't typically talk with, because that's where we really see innovation that happens.
I think from my point of view, one large area where we could actually do research is in agricultural and food producing practices that can be more sustainable and actually be more kind towards workers and animals and even our planet. I think one thing that we have, I don't think that we've emphasized enough, is just how extractive our food production system is, and it just doesn't extract from the workers and the animals, but also the way we treat our land, our planet. And one more thing that I didn't mention was the use of concentrated animal feeding operations, or CAFOs. That's also an environmental hazard that a lot of, not just farm workers, but rural communities in general are facing the consequences, and we're not holding those operators accountable. So I think that would be another area of research, to like what practices would actually be useful.
Hi, I'm Ana Bueno. I'm an environmental reporter with Univision 45, and thank you for bringing awareness about the lack of Spanish information for those communities that need it the most. So I also want to encourage every single outlet here to really probably hire a human translator instead of having a Google translator, because that will be really useful. And Ness, I have a question for you. You earlier mentioned that workers were already dehydrated even before they arrived to their job. So I was wondering if that has something to do with the male-dominated society that probably as Latino communities are immersed into. So probably that they will say, I won't say that I'm feeling bad, because then they will question that I'm a very strong male, you know. I know that probably male-dominated society sounds weird, but I mean, in our country we mentioned, vivimos en una sociedad machista.
I think it does play a role. Yeah, that machismo, that masculinity aspect does play a role, and then people definitely don't want to speak up, because also there's that social pressure from their coworkers about not being man enough to do the work. But I think also about a third of the workers are women, and they're also coming in dehydrated. I think there are a lot of factors playing into why people are not hydrating, and also just touching on what you were mentioning about male-dominated society, machismo. A lot of times women, when they come, they also work as farm workers, and they come home and they're the ones who are fixing dinner, getting the kids ready for bed, and all those other things. And I'm not saying that the men are not necessarily engaged in some of those home care activities, but most of those responsibilities still fall on women, and they may also not be taking care of themselves. So I don't want to downplay the role of machismo, but I think that we also need to make sure that women are aware that they also need to take care of themselves.
Hi, I'm Robert Frederick. I'm a freelance, and I teach a climate change reporting class for Harvard University's journalism program. I'm a little confused by some conflict that I heard in terms of OSHA standards, proposed new OSHA standards. I'll be very curious to read those and comment on them. Thank you for that prompting. In particular, that Ashley, you said thinking that one metric will work is insufficient. And so I wonder if these proposed OSHA standards are that sort of one metric. How do they include things like whether somebody is taking a diuretic, or how much alcohol they could consume, or what their age is, things like that? Is it that specific, or is it just one metric, 70 or 80, 90, 100 degrees, that kind of thing?
Yeah, so that's a really great question. Thank you for asking that question. It is one metric at different levels, right now is how it stands. And actually what I would advocate for is a slightly different approach entirely. And the first reason is because 80 degrees is a baseline, is every day in the Southeast. What do you think is going to happen in Texas? They're never going to get out of the period, right? So there needs to be a regional metric at very least, right, of thinking about this. 80 degrees is really, maybe extraordinary in Vermont or somewhere else, and that would be, in fact, really a big deal. The other thing is heat index is measured in the shade, for those of you who are not aware. So when you see a metric that says 120 degrees, 104 degrees heat index, that's in the shade. That is, in fact, not where our workers are working. And so I think we need to really think critically about how we do these metrics. In the Mendoza case, for example, they keep saying, this drives me nuts a little bit, that heat index was, and it was, the heat index was not that high that day, right? It was in the mid 90s, I think, or even low 90s, which that's like a pleasant day here in North Carolina in September. But if you looked at wet bulb glow, for example, which takes into account solar radiation and wind speed, there was almost no cloud cover, and wind speed was 2 miles per hour at the local weather station, which means that bus that they gave them for shade was an oven, not shade. It was a metal device that they were sitting inside of with no wind flow. And so wet bulb glow put us in black flag that day, which means stop work in military speak, right? So that just goes to tell you that we need to really, you asked about a research question, there's a lot of people doing this research. At the very least, we need to think about regional metrics, but we also need to, heat index, everybody loves it because National Weather Service did a fantastic job of helping us all understand feels like temperature when it's not actually the best metric to measure heat stress. But maybe things like departure from normal is a good idea, right? Because that tells us, no matter where you are, right, what that normal is. And that can be easily rectified or changed over time as that normal moves. The other thing is, it's also already borne out in a lot of the science, categories of, like vulnerability, 65 and over, with no underlying health conditions. Vulnerable population, quote unquote, susceptible or vulnerable population. So anybody has underlying health conditions fall in this category. Youth in this category. That's also something we already have. When we look at fan use and immersion techniques and things like this, they're usually divided up by these categories already. So it's not as if we don't understand how to do this already. And so you can think about, from an occupational standpoint, as having a range. I do not agree with the current way that they do it. I should be clear about that. I think there's so many problems with how it's currently structured.
Can I just add that I can't remember if it's in the proposed federal standard, but I have seen acclimatization periods raised as something, and those are more individual in a way, because you're only going to trigger your need for an acclimatization period if you're new to the area. So, if you just moved to North Carolina from Vermont and you're starting to work as a roofer, maybe you get the acclimatization period, but the person who's been working in North Carolina all along doesn't.
Hi, everyone. I'm Miriam Vidal. I am a freelance journalist from Mexico, and echoing a little bit what Anna just mentioned, and the question here about the research that is lacking or missing. I know that this may not be the priority when farm workers are basically dying because of heat stroke, but I would like to talk also about mental health. How much research there is into the mental health issues that these farmers are facing? How much, cases, stories you're seeing on how either heat, work conditions, migration conditions, all of them together are impacting them, their families, and the children.
I can. It's a complicated question. There's definitely been a lot of outreach done on mental health issues for farmers, but not a lot for farm workers. Also, the male-dominated narrative also helps feeds into that. And during the pandemic, we saw that often everybody was suffering through some kind of mental stress, but women found an outlet in religion, and they would in some focus groups that we did, they would say, like, it was through my faith that I was able to get through this. But men often didn't express an outlet. Maybe they did find an outlet somewhere, but none of them reported it. So I think maybe we also do need to do a better job in reaching out, communicating the need for mental health to society at large, but definitely in rural communities.
Can I add to that? At Wake Forest University School of Medicine, there's some anthropologists, Tom Arcury and Sarah Quant, lead a group that have done a lot of great farm worker studies, and they have done some specific to mental health, where they looked at farm workers in North Carolina. And then there's also a federally funded program here called the Farm Worker Health Program, that basically supports clinics throughout the state to do health outreach services to farm workers, and they have prioritized mental health over the last few years too. So it's something we're trying to address in North Carolina.
Hi there. My name is Liz McLaughlin. I'm a climate change reporter with NBC WRAL here in Raleigh. I had kind of a two-part question. I know we've talked a lot about farm workers. With Wendy Johnson, the postal worker who passed away this year, I was just wondering if you knew if the general duty clause was sort of applied there. I think about postal workers a lot, especially as same-day shipping becomes so ubiquitous here. They really are just these kind of hot easy bake ovens that workers are subjected to, and it's such a kind of vague clause. With Luke Farley being elected here as the labor commissioner, it keeps getting cited again and again that having heat protections would raise costs. I wonder if any of you guys are familiar with research that really quantifies the economic impact there, or case studies in other states that have successfully enacted protections with minimal fiscal impact.
Sure. So Drew Schindel from Duke and Luke Parsons, who was at Duke but now is at the Nature Conservancy, have both published pretty extensively on the economic impact. There are many others who have also done the same. We're in the process of wrapping up our study that's forthcoming on the economic impact of like changes in work regime and what that savings would be. So yeah, there are several. There's quite a bit of good work coming out right now from Arizona State University, UCLA, and other universities, particularly in the Southwest. So so that work is definitely out there, and the one that I usually fall back on a lot is the Schindel and Parsons work. And I'm happy to, if you connect with me, I can send you some of that work.
In terms of the, it's kind of a technical legal answer for you on the general duty clause stuff. Because she worked for the U.S. Postal Service, she actually, even though she was in North Carolina, right? That happened here, but it's still under the federal OSHA because she's a federal employee. So it would be, however, Acting Secretary of Labor Julie Sue's OSHA interprets it, and I don't know if there was a complaint filed in that case and what they found. I mean, as someone who represents employees, I would say, yes, that was clearly not a safe and healthy workplace if she died because of her work conditions. I don't remember all the details. I think she went to take a nap in the back of her delivery. I don't remember it exactly, but so I don't know if it actually should have violated the general duty clause, but I will say that there are state transportation workers and airport workers and other state-level transportation folks in North Carolina organizing about heat conditions too. And fast food workers, we haven't mentioned them. There was an event last year out in the Asheville area where some fast food restaurant workers were organizing for heat standards.
Just on the general duty clause, I mean, I was trying to remember this number now and I just looked it up, but there's a farm worker in Florida who died a couple of years ago who got, and the farm got fined by OSHA under the general duty clause for being responsible for this person's death. And the fine they proposed was $28,000, which isn't that high depending on the size of your business and in terms of motivating behavior. We were talking earlier about making the cost balance out. There's a limit to, I think, what the general duty clause can do on that front.
To that research question earlier, what I was going to say is, can we get some research on what is the threshold that would motivate employers to change their behavior? That's what I want to see.
We did that with hog farms in North Carolina, right? The fine for, or they have to clean up themselves, the fine for not, in fact, cleaning it up yourself is so extreme that it puts you out of business, right? So it has definitely motivated hog farmers to institute different practices. So that's definitely one approach.
Hello, everybody. My name is Vanessa de la Cruz. I come with the University of Nevada, Reno, and I have two comments that I'm not sure they are questions, but one of them is I think it is very important what you actually mentioned about including the industry in these big conversations, and I want to share just super quick a case in Nevada, and it's Reno, Vegas, the two fastest warming cities. We have also H-2A visa workers that go to farm, thousands of them, mainly from Mexico and Central America. And we just had a Senate bill that didn't make it either, that was just asking for water breaks and shadow and all of that, and these big corporations were pushing it for no, because they said it was kind of too obvious and so on. So I guess for journalists, my call is let's support those small organizations that are fighting for the rights of these workers, especially Latino workers in this case. And then super quick, the second one, what Anna was saying too, and you too, like, I think also because I interviewed some of those Latino workers, they just don't know what's going on. They don't really are informed about the numbers and what's risky for them and where the opportunities are. So I think it is the culture. Many of them say like, yeah, we are stronger, like our bodies are ready for this, and in our countries we do this and that. But yeah, it's kind of machismo, but it's also like misinformation. So I was wondering if there's any other ideas you think journalism should be like focusing, so we like inform these communities of what should be made and what is being done.
I think journalists have a role to play here to help get that information out. Like so in my work, like part of our work is educating workers about their rights. And we do that through some direct outreach to visit workers, but like reaching all of the farm workers in North Carolina is impossible. Sometimes when I don't know if I actually am not on the outreach team anymore, so I don't know if this is happening, but we used to take copies of the Spanish language newspapers that are published in this area with us out to Eastern North Carolina. Like, here's the papers. Sometimes we have gotten PSAs on Spanish language radio to announce things that we're really trying to reach folks. We've shifted a lot to social media now. We're doing, Instagram and Facebook stuff and trying to use WhatsApp. But, I think we need to use all the things, especially when we're talking about saving people's lives. And, yeah, I definitely think, when this is covered on Univision or this is, covered in the Spanish language media, that's going to help.
Okay, let's make this the last question super brief.
Yeah, mine's a policy question. My name's Helena Salomon. I'm a science reporter at the New York Amsterdam News in Harlem. We have an act, the Temp Act, that's in committee. My policy question is, in watching states pursue such legislation, what are the things to watch that could be lost in the process or negotiated out? I'm wondering if there are important elements to the policies that you see often disappear in the process of getting passed into law or being pursued. And if there's anything you think we should be especially watching out for or think is especially important to keep in this legislation.
Well, I think something that we were just kind of circling is like, what's the penalty when an employer doesn't comply with it? So making sure that penalty is big enough to motivate. The other thing is, as the lawyer up here, like how is it going to be enforced? Can you sue over it, or is it just going to be up to an agency to make sure they're enforcing it? Because if you've got an understaffed agency that can't get out there and investigate everyone, then that's not going to be adequate. You need access to the courts to enforce it too. So I just flagged those two things.
I think what I would say is a lot of times when we think about policy, we don't think about then sort of, I guess, for lack of a better term, governance, how we're actually going to implement the policy. And so we don't include that in the policy. And so requiring things like protocols that are actually written so that everybody knows. One reason why those things are very important is because as there's turnover in organizations, the new people that come in that weren't part of that original group, that when the regulation was passed, right? So there should be something written, right, that it's required that there is a protocol that must be followed that outlines the covered work activities, which this one does, is one of the things I like about it, and exactly what should happen at certain times in certain circumstances, right? That's key, because otherwise there's not consistent implementation of the policy, and therefore the impact of the policy is less.
I would just add, also keep an eye on changing language from committee to committee, because they'll go from one committee and they'll strike versions of it, and when it goes to the next committee, it'll be a completely different version. By the time it gets to the floor, it's not what that first bill looked like. So just keep that in mind.
And thank you guys so much.